with Dr. Robert Denton, who works in emergency medicine. How are you today, doctor?
Fine, and how are you?
Good. So I heard you worked in emergency medicine. Can you tell me a little bit about what you do in that?
Yeah, I've been an emergency physician for over 20 years. I work at Rex Hospital Emergency Department. I've been for 20 years. And I work every day, or nearly every day, in the emergency department.
So starting your career, how much and what type of education did you have to receive to become to this?
Well, to become a physician, the path includes, obviously, you need to get a high school diploma, high school graduation. Then you go to college. You need a 4-year. For all medical schools, you need a 4-year college degree. There are pre-medical pathways that you can take, or you can go into other fields, and as long as you take the requirements in college for pre-medicine. And it usually involves at least a year of chemistry or biochemistry. You need math. You need usually higher levels of math, at least up to algebra and sometimes calculus, but not necessarily calculus for math programs. You need biology, physics, all the major basic sciences. But in any degree that you get, you need a 4-year college degree. After that, you apply to medical school. And once you get into medical school, which is application processes, usually includes taking a test called the MCATs, medical college. I'm not sure what MCATs stand for specifically, but we'll have to look that one up. MCATs is a test that you take to get into medical school. MCATs. So you have to take that test, you have to apply, and you have to have all the prerequisites to get into medical school. And then you have to get accepted in medical school through an interview process where they look at your grades, they look at your MCAT scores, and then they do an interview with you. And usually some online interview application process. And once you're in medical school is a 4-year program. Usually the first 2 years are what we call basic sciences, where you learn all the sciences and about the human body. And the second year is more where you learn the diseases of the human body. And in your third and fourth year typically are what we call clinical years, where you rotate into different services of medicine and learn all about patient care, where you're truly taking care of patients and learning about the diseases that they have. So that's usually your third and fourth year of medical school. So that's getting through medical, or getting into medical school or through medical school. Usually takes that time of training. So 4 years of college, then 4 more years of medical school after that. And then depending on what type of medical physician you want to be, there's a training program called residency, which is anywhere from 3 to 7, can be up to 7 years, depending on what specialty medicine you want to go into.
What did you specifically study?
I went to medical school at West Virginia University, and once again, 4-year medical school. And after medical school, I applied for emergency medicine residency and got accepted to Wake Forest University residency program. And there's in emergency medicine specifically, there's about 125 residency programs in the country that I can apply to. And once again, there's an application process, and there's an interview process, and then there's something called the match, where the programs try to match the applicants that are applying to them with their programs. And there's one day in, I believe it's in March or April, that is called Match Day in your 4th year of medical school. Everybody finds out which residency they get into based on the match. So you don't know until March of your last year of medical school where you're going to go to residency. I applied to about, I think 11 different residency programs, and ended up getting first choice, which was Wake Forest University residency. So.
How long were you in residency?
An emergency medicine residency is 3 years. Your first year is called your internship. A lot of people have heard that term, internship. That's usually, for every program, your first year is called your internship. That's your first year of residency. For emergency medicine, it requires 3 years of training. So, and within that residency, you're learning how to be an emergency physician specifically, and you do different rotations, as we call it, each month in different services, like trauma surgery and pediatrics, and you do oncology rotations. Each month you'll do different services like that, and then you'll do several months in the emergency department to learn how to manage patients in the emergency department. That's part of your training, although you do get paid for that. You're a paid physician, but it's still called a training program.
Yeah. Gosh, you've gone through a lot of work so far. So how much and what type of work experience do you have?
Well, most of the experience that you get in medicine is through your residency program. That's really where you do a lot of training, and it's long hours, and it's you're on call depending on what service you're on. You're on call, usually every third or fourth night, where you're staying at the hospital, taking care of patients through the night, and managing them through their illness. So that's where you get a lot of your experience and training. And then once you have that experience, then you apply for jobs.
Yeah.
And you're trained, and you've been practicing as an emergency physician for 3 years during that residency program, but it's still a training program. And then you can apply for jobs, and there's different paths that you can take in that pathway too. You can in that realm, you can take a path of working in a community hospital. You can work in a teaching hospital. You can work in research if you like. Even with that residency program, most emergency physicians tend to want to practice. If they're doing a residency, they want to practice in that realm of seeing patients. But some like to do straight research, or some like to get into the different fields like emergency medicine, or even toxicology and taking care of poisonings and things like that, which are sort of within the realm of emergency medicine. So they'll sometimes do even more subspecialty training above and beyond that. If you enjoy that type of activity, then you can do that.
But you didn't do any.
I didn't. I did 3 years residency. I like to work in a community hospital, taking care of patients every day, and being able to make a difference in patients' lives. I wasn't really into research, or I have some interest in toxicology, but it's a personal interest, where poisonings, and so I've done a little more study in that realm on my own. But there are pathways you can take to even get subspecialty and work in a poison center and be a subspecialist in that as an emergency physician.
So you've had 3 years before you went and worked. Okay, so in your job, what is something that you like about it?
Well, I mean, it's a challenging job every day. Every time you walk in, you're challenged potentially by what comes through the door. You're not sure what's going to come through the door next. You do it every day. You're sort of used to the standard approach to most complaints. Most patients come in with some of the similar complaints in a community hospital. It tends to be something wrong with their chest or their stomach or their head, or they have a fever or cold. But every once in a while, you get some more serious cases that are truly life-threatening problems, and we have to be ready to strike when they come in. Somebody that's serious having serious breathing problems, or somebody having a heart attack or a stroke, or sometimes we get serious trauma patients that will walk in the front door. Now, the hospital I work at is not a trauma center per se, but a lot of emergency physicians have training and work in trauma centers, and have to be ready for the gunshot wounds or the stabbing, the major car accidents that are coming in seriously injured with broken bones or bad head injuries. And we have training to handle all those, and to rapidly see those patients and stabilize them, and try to identify all their injuries, and take care of the acute emergency problems, and then call for assistance from specialists once we've diagnosed it. So we're sort of specialists in trying to find out what's wrong with patients. That's what our training